Welcome back to Therapy Thursdays on Louisiana Living. We are Fyzical. I'm Angela Yarborough, and this is Dr. Jerry Yarborough. We at Fyzical want to help you get back to loving your life. If there's anything that's physically preventing you from doing that, that's why we're here. We love to help you get back into doing the things you love. So for the details, let's see, what are we doing here, Dr. Jerry?
Thank you. So what we are doing here is on a weekly basis every Thursday on Louisiana Living, we are talking about different diagnoses or conditions that may be impairing your quality of life. And we're talking about how physical and occupational therapy can help you overcome those impairments. And what we've been talking about the last two segments of the series of three was about back pain and sciatica. So we're talking about the three most common causes of back pain, which can cause sciatica. The first one was, if you remember, was about stenosis and degeneration, arthritis, all that kind of goes in the same bucket. And that was where, standing and walking for longer periods of time would increase your pain, and you had to sit down for relief. Those are the golden symptoms of stenosis and degeneration causing your back pain. The second segment, we talked about back pain and sciatica being caused from a disc issue, whether that's herniation, bulging. Those are just different levels of a bulge, and how that can impinge upon a nerve and cause pain in your back and shoot down your leg. And the most common symptoms for that, if you remember, was typically in people around 40 or younger, kind of the weekend warriors. They get out there and do things that they're not used to, and they kind of irritate their back. And their pain would be increased with bending, coughing, twisting, sneezing, those kind of things. Those are the golden symptoms of back pain caused from a disc issue. And today, what we're going to be talking about is the third most common cause of back pain and sciatica, and it's from SI joint pain. S being sacrum, I being ilium, and that's down here. And we're going to talk about the golden causes of SI pain. And as always, we want to give you a takeaway. So we'll be going over the three most common exercises to help you overcome SI pain. So come back after this segment and we'll get started on it. Thank you.
Welcome back to Therapy Thursdays on Louisiana Living. We are Fyzical. I'm Angela Yarborough, and this is Dr. Jerry Yarborough, and we are talking about back pain. Back pain is like the third leading cause of going to the doctor these days, so we want to make sure that we address that. It's a big deal. Dr. Jerry?
Exactly, it is. And here at Fyzical, we are the area's leading experts in treating back pain. And that's why we've been talking about the three most common causes of back pain. Remember, we talked about arthritis and stenosis being one common cause, then disc issues being a second most common cause, and then now we're talking about the third most common cause, which is SI pain. S again stands for sacrum, and I stands for ilium. As you see here on the graphics, the sacrum is the bottom of your spine. So it comes from the lumbar vertebra down to the sacrum. And the sacrum is connected to your pelvis, and that bone of your pelvis is called the ilium. So the SI joint pain. And the most common symptom of SI joint pain is what we call a thumb rule. If someone says, I hurt right here, that's golden SI joint pain. The most common causes of it is, like you're going to step and that step was just a little bit further than what you thought, and you get that jar, and that knocks that SI joint out of alignment. It could also be traumatic. It could be because of, arthritis, weakness of the ligaments that hold all that together. And very commonly with women, through hormonal changes or childbirth, that SI joint will become very weak and lax and cause problems. So Now, so the common symptoms that go with that, again, the golden thumb rule right here. It could also be pain when you're sitting for a long time, or pain down the side of your leg, or even into your groin. You know, a physical therapist, through proper assessment, can easily determine that, and most of the time, very quickly fix it. But unfortunately, through x-rays and MRIs, it's the most commonly missed because that malalignment is so little that it can't be seen. But if you ever have it, I promise you, you will feel it because it hurts like heck. So again, here at Fyzical, we are the back pain experts in this region, and we would love to help you. Come to our next segment and we'll talk about the 3 most common exercises for you to deal with this at home. Thanks again. So welcome back to Therapy Thursdays here on Louisiana Living. I'm Dr. Jerry Yarborough with Fyzical Therapy and Balance Centers, and today we are talking about the common causes of back pain, and the third one, or the third most common cause is SI joint pain, and that's what we're going to talk about, the 3 most common exercises to help you. Remember that golden thumb rule, if you're hurting right here on one side or the other, that's more than likely it's SI joint pain, and you can do these 3 exercises immediately to try to help you overcome that pain. Today we have Cassie Connolly. She's one of our awesome licensed physical therapist assistants here with us, and she's going to be our demonstrator. So she's going to lay down. All right, so if you're hurting on your right side, more commonly than not, that right side has posteriorly rotated, and what you're going to do is you're going to pick this leg up toward your head, but resist it with your hands. So you're trying to move it toward your head, but you're resisting it. And with this leg, you're pushing it down into the mat. So you're trying to get that reset of the SI joint, okay? So you're gonna push as hard as you can. You're gonna hold it for 10 seconds, and then you're gonna relax, and you're gonna do that 3 times. All right, give it about 10 minutes or so. If that didn't resolve your pain, go back and do just the opposite. Push this leg down, pull that one up and resist. Hold it for 10 seconds and do it 3 times. All right, so very easy. You can do that at home. You can do it laying down. You can even do it sitting up. The next one is called hook line abduction. These are exercises to help stabilize the SI joint, okay? You can use a ball, you can use a pillow, anything like that. And you're gonna put it between your knees in this position. You're gonna squeeze as hard as you can, hold it for about 10 seconds, and do that about 10 times, okay? Again, you can do this laying down or you could do it sitting up. So you're gonna squeeze, hold for 10 seconds, and then relax. And then the third most common exercise to help stabilize that SI joint, you can get a TheraBand like this. You can purchase these online or pretty much any store, Walmart, any of those places have them. So you're gonna wrap a TheraBand around your knees like this and push your knees apart. You're gonna hold it for 10 seconds and then relax. You're gonna repeat that 10 times, just like that, all right? So those are the 3 most common exercises to help overcome SI joint pain. Go ahead and sit up. So again, thank you for joining us today on this segment of Therapy Thursdays, and we'll see you next week.